Martha TOLANA worries finding drugs for chronic illnesses is going to get a lot harder for poor and struggling Zimbabweans. Some public health centers have no drugs for HIV patients. The cost of 1 month's supply at a private pharmacy is roughly $60 US. A civil servant earns about $70 a month.
If you are going to buy ARVs, you are caught between a rock and a hard place because you know you need the ARVs for you to maintain your life. But then if you buy the ARVs, that means you don't have food, you can't look after your children, you can't look after, all the people that depend on you.
Those who can afford it go abroad for their treatment. Others use the well-stocked, expensive private facilities, a luxury millions of others don't have. Zimbabwe has more than 20 registered health insurers who have about 800,000 members. The government has its own health insurance for civil servants, which caters roughly to 340,000 workers. That means most people here don't have medical coverage. While children under the age of 5 receive basic free treatment at public hospitals, everyone else without health insurance pays cash.
For effective pain management, the patient must have regular, uninterrupted access to medication. The medication has become extremely expensive. Traditionally and historically, that medication has been funded largely by donors. But we're finding that donors themselves, not through lack of will, but because of pressures on them, mostly local donors, they're unable to support that.
Doctors have been striking for nearly 2 months over poor pay and work conditions. It's another sign the public health sector is in trouble. After numerous negotiations broke down, the government issued this ultimatum.
Doctors who are not coming to work will be disciplined. So the first thing, whoever is not coming to work, they will not be paid.
Some here blame the collapse of Zimbabwe's public health care system on corruption and the state's failure to prioritize. Government officials say Western-imposed sanctions are the reason for the crisis, not them. But it's patients who end up suffering. And as Zimbabwe's economy worsens, there is no sign their situation will improve soon. Haru, Mutasa, Aljazeera, Harare.